Hello, and welcome to Scholars Hub at Home. I'm Cary Williams, Associate Director of Alumni Events at York University. Thank you for joining us today. This webinar is part of our Scholars Hub Speaker Series and features timely and relevant educational lectures by academics and researchers from York. We're pleased to be able to bring this series online to allow even more alumni and our friends to hear from some of the university's leading scholars. The lecture will also be available on our YouTube channel, so you may share it with your friends and family. As this event is virtual and we are not all gathered in the same space, we recognize that this land acknowledgement might not be for the territory that you are currently on. We ask that if this is the case, you take the responsibility to acknowledge the traditional territory you are on and the current treaty holders. As a member of the York community, I recognize many Indigenous nations have long-standing relationships with the territories upon which York University campuses are located that precede the establishment of the university. We begin today by acknowledging we walk upon the traditional territories of Indigenous peoples, and we recognize the history, spirituality, culture, and stewardship of the land. We are grateful to all Indigenous groups for their commitment to protect the land and its resources, and we are committed to reconciliation, partnership, and enhanced understanding. For 20 years, the Bryden Alumni Awards celebrated alumni who have changed the world for the better. The tradition of recognizing their contributions will continue at the York U Alumni Celebration, honoring 20 years of Bryden Awards. It's a virtual event happening on November 19th at 7 p.m. And it will bring 20 years of award winners together with York's global community of alumni, friends, students, and York leaders for an entertaining and inspiring evening. We're thrilled to be able to offer complimentary tickets to this event and hope that you can attend. You can RSVP today at alumniandfriends.yorku.ca/Bryden, and that should appear on your screen. In other exciting news, last week the university announced a $10 million gift from the R.P. Bratt Family Foundation toward the creation of the university's new Markham Center campus set to open in 2023. In recognition of this generous gift, the atrium in the new campus building will be named after the Bratt family. Before beginning today's lecture, we always like to get to know our audience by asking you a question. It should appear on your screen now. How would you rate your understanding of today's topic? A poll should pop up, and I'll just give everybody a moment to respond. Thank you. Thank you. Okay, so we see almost 70% of you are somewhat informed, and the balance is minimal. So that's really helpful for us to know that. It's also helpful for our speakers. So he understands just who's in the audience. Thank you so much for sharing that. If you need help with the Zoom webinar at any point, please feel free to click on the Q&A button at the bottom of your screen and enter your question. Our team is here to help you. And that same button can be used to submit questions to us throughout the lecture because we will have a Q&A period at the end. And for those of you who are watching live on Facebook, feel free to submit any questions or comments to the comment section, and the team will send them my way. Today's talk is titled Acute Discrimination and the Asian White Mental Health Gap During COVID-19, featuring Dr. Cary Wu, Assistant Professor, Department of Sociology, Faculty of Liberal Arts and Professional Studies. Cary Wu is an Assistant Professor of Sociology here at York. His research focuses on political culture, immigration, and inequality. He often shares his research with the public through national and international TV, radio, and newspaper forums, including NPR, CBC, Toronto Star, Macleans, and the Financial Times. Welcome, Cary. It is an absolute pleasure to have you here with us today.
Thank you, Cary.
So the floor is yours.
Yeah, I'm going to share my screen. Good afternoon, everyone. Thank you for joining us today. I'm Cary Wu. I'm an Assistant Professor of Sociology at York University. Today, I'm going to share with you my recent research with colleagues from York University and also from UBC, and on anti-Asian racism and how that affect mental disorders among Asians and also other minority groups, in particular Asians, in Canada and also in the United States. So did you know before the pandemic, Asians, they usually report lower levels of harassment, threat, or insult. They also report like fewer mental health conditions than white in the United States and also in Canada. A lot of evidence show. So after the pandemic, or since the pandemic began, what happened? So today I'm going to try to answer this 4 specific questions. First, how widespread is the anti-Asian racism since the pandemic? Second question is how discrimination, racism can harm mental health. And the third question is, has the rise of anti-Asian racism changed the Asian and white mental health gap? Finally, I will also talk a little bit about what can be done. You probably read news about the rise of anti-Asian racism, right? So from the survey, I saw that 67% of you say that you were informed on this kind of topic, the rise of anti-Asian racism, right? For example, this is a picture, right? In Vancouver, an Asian woman was punched without any reason. And in the United States, Asian Pacific Policy Planning Council and several other organizations, they came together, they collect those incidents, right? So things march until August 5. So there have been over 2,500 anti-Asian racism incidents, right? So Asians were verbally or physically attacked. In June, Pew Research Center, they did a survey about over 9,000 US adults. So they reported that over 30% of Asians have been subject to slurs or jokes because of their race and ethnicity. And 26% of Asian Americans said they feared someone may threaten or physically attack them. Agree that it has become more common for people to express racist views toward Asians since the pandemic began. In Canada, StatsCan, they did a crowdsourcing survey in May. So they reported similar findings, like here in Canada, over 30% of Chinese say they perceive more harassment, this increase in harassment or attacks on the basis of race and skin color. 26% of Koreans say the similar, and also over 15% of Japanese and the Filipinos, they say they perceive more anti-Asian racism. Right, so what are the consequences of the rise of anti-Asian racism during the pandemic? Right, so we're thinking about how, for example, racism and discrimination can harm not just mental health, but also physical health, right? So in sociology, there's growing literature talking about how overall health is affected or shaped by the places we live or social inequality in general, right? Who can buy what food, community context, all those. In particular, when people experience discrimination, racism, and how that affect people's health, right? So one theory scholars develop is to explain how discrimination and racism can harm mental health is minority stress theory. So this theory suggests that when there's discrimination, the discrimination often create an environment, stressful environment, right? And the excess in social stressors, for example, feeling of hopelessness, self-doubt, losing control, or that kind of stressors could lead to higher levels of mental disorders. So during the pandemic, right, the rise of anti-Asian racism, a lot of Asians have been facing discrimination. They were attacked verbally or physically. And this could lead to race-based stress or trauma. And those leading to Asians, the feeling of hopelessness or even the internalization of negative views toward them, right? And this could explain their mental disorders during the pandemic. This is one story. So a few months ago, Toronto Star reported one study. So York Center for Asian Research, they post this news article on Facebook. And here we received 2 comments from Frank Yong. Right, so first comment, he shared about his experience in Chinatown. So one white middle-aged woman was shouting at him saying F Chinese, right? So, and then later on he added another comment. He said, this kind of comment, this kind of experience really affect his mood, right? Really, he felt disgust because of this experience, right? So this kind of experience could affect his mental health in general, right? So this is an illustration of like how people's experience of discrimination or even perceive discrimination or even witness other, for example, other minorities' experience of discrimination or being attacked, then how that could affect mental health of minority populations. So I am a survey researcher. So I teach social statistics. I study use survey data to do research. Right? So in the United States, the University of Southern California, they have been collecting a high quality of data, tracking almost 8,000 US individuals and over like since March and until today. So there's in total 13 waves of data have been collected. So using the data, so I can show you that the differences between white and Asians in their mental health, and also the differences in the perceived discrimination between white and Asians. This is such a good data because it's longitudinal panel data, right? They track the same individual, same group of individuals over time, each month. Here are some findings. So if we focus on discrimination, you can see that white perceive lower discrimination during the pandemic, right? And Asian Americans in particular report higher level of discrimination. And Asian immigrants also report high level of discrimination. In terms of mental health, you can also see that Asian Americans overall in general, from the whole data set, they report the highest mental disorders. And then next is Asian immigrants, but then Asian immigrants and white, the gap is smaller, right? So there's research suggesting that immigrants often can be more healthy because there's a healthy selection effect of immigrants, because young people are more likely to be immigrants, right? So that the gap between white and Asian immigrants is not that big, but then you see Asian Americans have the highest level of mental disorders. So this is using the data. If we look over time, this temporal changes can kind of like give us an idea about how the change in perceived discrimination lead to changes in mental health conditions, right? So you can see, so in total, the data has 13 waves. So first wave is in March, and after March, every month, two waves of data were collected. So the first wave is in March. So you can see, starting from March, Asian immigrants, including white, right? They report more discrimination, COVID-19 related discrimination, especially for Asian American. There's huge jump from March to April, into April, right? Especially in April. And if you look at the figure on the right side, that's mental disorder, right? So with the jump, with the rise in discrimination, there's also a huge jump in terms of mental disorder among Asian Americans. So this temporal changes could inform us. These two changes could be related to each other, right? So give us a causality that rise in anti-Asian racism could lead to rise in mental disorder, especially among Asian Americans. And also, if you look at this table, so in the first model, we look at the gap between Asian American, Asian immigrants and their mental health. The reference group is white. So the positive numbers here show that Asian Americans are more likely to report higher mental disorders, right? And then Asian immigrants, the gap in mental health between Asian immigrants and white Americans is not significant. It's also even negative. This means that Asian immigrants tend to have better mental health than white Americans. So this also suggests like it's inconsistent with literature that there's a healthy immigrants effect. Immigrants tend to be healthier because they often younger, right? And after the second model, after we include discrimination, you can see the decline of the gap and the increase the gap among Asian immigrants and white. So the findings suggest that discrimination can partially explain Asian immigrants' increase in mental health among Asian immigrants, right? And then if there's no discrimination, Asian immigrants will be even healthier. You see the change in size. And the Asian Americans, there's a decline in the size of the effect. So that this model suggests that discrimination really can explain the gap between mental health, not only Asian American white, but also Asian immigrants and white. In Canada, the data shows very similar pattern, right? So on the left, you see white have lower mental disorder compared to East Asians in Canada. But discrimination, East Asian Canadians report more discrimination than white, right? And after I run the model, it tells the same story, right? So first, discrimination can significantly explain mental disorder. And then when we include discrimination, there's a decline in the size of the effect of how, or the gap between East Asian and white Canadians. So in general, 4 findings from 2 studies we have done. So first is that since the pandemic began, Asians in Canada and also in the United States have experienced higher levels of mental disorder than white. Second is that Asians reported higher instances of COVID-19 related discrimination. A third finding is that experience of COVID-19 associated discrimination can lead to increased mental disorder. And finally, I showed that those discrimination can partially explain the mental health gap between white and Asians. So finally, what can be done, right? So before the pandemic, Asians often report better mental health, and they also report fewer instances of discrimination, harassment, right? But during the pandemic, there's a rise in anti-Asian discrimination. And the Asian Americans, Asian Canadians, they have also been experienced more mental disorder. So what can be done? 3 general suggestions, policy implications. First is that we really need to develop group-specific health interventions and support. Especially in Canada and the United States, Asians are less likely to use mental health services for a lot of reasons. For example, language barriers or some other reasons that a lot of research suggests that Asians are less likely to use mental health service. But then during the pandemic, they were affected more because of the anti-Asian racism. So we really need to develop group-specific mental health interventions and support in responding to the mental health impact of the pandemic. Second is that health professionals, they play a key role in countering racism and its consequences. So it's also very, very important to ensure that medicine as a field continues to care for all minority communities. And from the policy perspective, right, to really address the mental health impact of the pandemic for different minority populations, we really also need to think about how policy level can tackle the hate, violence, and discrimination, especially those experienced by those Asians during the pandemic. So thank you for listening.
Dr. Wu, thank you so much for that. Just before we get into the Q&A, I need to make a correction to something I said in the intro. It was the RP Brady Family Foundation that made a $10 million gift to the Markham Center campus. The lobby will be, the atrium in that building at that campus will be named after the RP Brady Family Foundation. So I just needed to make that correction. Thank you so much for that. So interesting, such good information. We do have some questions if we can get into that. One moment here. So we have a question from the audience from Michael, and he asks, as a result of the COVID-19 global pandemic, everyone seems to be stressed out these days. Do you think that the frustration that people are experiencing is leading to that increase in aggression, some of those examples that you gave us?
That's a very good question. Yes, so when we think about the rise of anti-Asian racism, right? So there are a lot of factors that could explain the rise of anti-Asian racism. The one factor is, yes, because of the pandemic, people were feeling stressful, not just Asians, everyone, right? When we experience the pandemic, the stress, anxiety often lead us to make decisions or do things that are irrational, right? So yes, it's true that anxiety, stress could lead to as one big reason of why there has been a rise in anti-Asian racism.
Yeah. Okay. Thank you for that. Another question is: before the pandemic, anti-Asian sentiment still existed in various areas. The pandemic just exacerbated the original anti-Asian racist sentiments that are already embedded. this is a multifaceted problem of which health professionals and public policies can only do so much. And you sort of spoke to that sort of on your closing slide there about what can be done. This audience member is wondering what else could be done from your perspective.
Yeah, so very, very good observation. Yes, even before the pandemic, Asians or minorities in general in Canada, in United States, experience a lot of discrimination or like xenophobia, right? So like, so it's the rise of anti-Asian racism is a historical issue, right? It's just like historically, Chinese or Asians in general, or minority populations in Canada and in the United States, they have been facing discrimination, yeah. Right? Then people here often see them as like foreigners, right? And then they also connect minorities to like dirty immigrants, right? Historically, long time ago, right? The pandemic is just like a trigger or like a leak, expose the problem even worse at a different level. Mm-hmm. Yeah.
Yeah. Thanks for that. And I think the content that you shared that was new information for many of us is the difference in how it's affecting Asian Americans versus Asian immigrants, like that. And you said basically it's because the Asian immigrants are younger and therefore healthier. Is there anything else that would be at play in there to sort of make for that difference in sort of mental health impacts?
Very, very good, very good question, right? Thinking about like why in over research we pay particular attention or like separate between Asian Americans and also Asian immigrants. It's just like the reasons like make us believe that this two groups of people could face differently in terms of like anti-Asian racism. One reason is that I mentioned is like in literature is the healthy immigrants effect, right? So the selection effect. Immigrants tend to be younger, tend to be stronger because they have come far away from outside, right? Often. Right. So that's one reason. But you're right. There are other reasons, right? Because for example, could be language or culture. Right? Because the understanding or the belonging, right? For many immigrants, for example, for international students, because sometimes the language problem, even people shouting at them using, for example, jokes, slurs, they couldn't understand what's going on, right? Yeah. And also in terms of like belonging, because they are not connect themselves very close to local society. So for example, Asian Americans or Asian Canadians, they were born here, right? So they belong here, that this is their home, right? For immigrants, sometimes they still like trying to, or they struggling with their sense of belonging, right? Yeah. So their social support often come from their home country, the country where they originally came from, right? But then if local Asian Canadians, local Asian Americans, when they face discrimination here locally at home, so that could lead to higher effect of the anti-Asian racism, right? Because at home I'm discriminated, right? For immigrants,
this is where I belong, and it's I'm not fitting in. Yeah. Okay. Thank you. Another comment from the audience, if I may. Thank you for a great presentation. Can you please share some strategies on how we can offer mental health services that are targeted specific for members in the Chinese community, and how do we make this a reality?
Yeah, so there's a lot of research show that Asians, especially Asians, they are less likely in Canada and the United States, they're less likely to use mental health service, right? So there are a lot of reasons, right? So before we can do something about it, we need to figure out the reasons why they are less likely to use mental health service. Like one reason could be, for example, language barriers, right? Especially for immigrants, right? Because of their language or cultural barriers, so they're less likely to use, or they don't know how to use those medical or information, where to find medical health support, mental health service, right? So one reason could be
so many barriers, right? So many barriers.
Yeah. Another reason is like, especially for people from for example, East Asians, when they think about mental health, they have different opinions about. So here in Western society, we are more open about mental health, right? So when we're facing mental challenges, we are more open when we find ways to deal with it. But then traditionally in China or in East Asian countries in general, when they are facing mental health problem, they perceive that it's a stigma, right? So they're less likely to reveal they have mental health problems, and therefore they're less likely to turn to doctors or turn to like medical professionals. So what we can do is like trying to like reduce the kind of stigma, right? So mental health is just a health issue, then could be like more open, talk about it, and then do not kind of like stigmatize mental health problems.
Yeah. It's a speaking of mental health, it is a shift, right? It's learning a different way to think about what you're experiencing, which is a massive piece of work, especially in this context, to think differently about how you're feeling, your mental health.
Yes, yeah. So like because over the last several decades, there's a huge rise in mental health problem among population, especially for now young people. They experience more and more mental health disorders, right? So over the years, so then it has become a big issue.
Yes. We have lots of questions, and Professor Wu. And this I don't know, this wouldn't be something that you can answer from your research, but perhaps from sort of just knowledge, a question from somebody, a difficult question. If someone or oneself is experiencing a racist attack, what steps can be taken in the heat of that moment, or how can people protect themselves?
Yeah, so that's a very challenging question, right? So like,
it is.
Yeah, what people have done, for example, in the United States, also here in Canada, is that we encourage organizations, like we encourage people to like stand up, come up, to talk about it, right? So what they have experienced and how that affect them. Don't make people to be aware that this is a big issue, right? And then also encourage those like who experience discrimination to like talk about and then like to face, and then also to encourage media report, and also like request policy, the government to do policy, to create policies to address those issues. So one thing is like really in Canada, also in the United States, a lot of like NGOs, they have been putting effort to collect those cases and encourage people who experience discrimination to come up and report and share their experience and how that affect them.
Right. Yeah. To share the experience. And if I may add to the audience member, speaking personally, it's in the heat of the moment, it's what's most important is that you come out of that moment physically safe, and you don't always know who you're dealing with. So to Professor Wu's point, when you get out of it, it's important to talk about it and get the support in the moment. Make sure that you keep yourself physically safe because you just don't quite know who you're dealing with. And so just try to keep that in mind. Yeah. Another question from the audience, do you attribute this trend, this increase in anti-Asian racism at all to the amount of sort of very explicit negative messaging about COVID-19 in China that's coming out of leaders in the US?
Yeah, so like a lot of research have been done, like using big data online. So for example, when Trump mentioned the coronavirus as Chinese virus, and how that changed like Chinese or Asian Americans' mental health. So like the temporal changes I show you, there's over time, there's a spike, like not just in April, but also in June, where like Trump talk about coronavirus or refer the coronavirus as Chinese virus, and that really is becomes like a political issues, right? And then that lead to also damage Asian Americans' mental health, or not just Asians in the United States, or like globally has impact on Asians.
Yeah. Very. It's people in those positions have so much power and influence, and to put something out there that you can see the effect in that, we see a rise in mental health disorders in Asian Americans, almost directly related to those kinds of comments. It's very, very troubling, very troubling.
Yeah.
I have a few more questions here. Just a moment here. Thank you. Thanks for waiting there. Could you share with us why is your research focused on the Asian white mental health gap and not other minorities?
I focus on Asians because the research suggests that most discrimination during the pandemic is directed to Asians. Not one reason is because the coronavirus, the outbreak started in China, in Wuhan. Yeah. So there's why that's most discrimination is directed to Asians and like Chinese in particular, and yeah, like Japanese, Korean who look like Chinese. And then second reason is that also only like in my data analysis, I show like only Asians report higher COVID-related discrimination. So not other minority groups. So that's two reasons why I focus on Asian. And compare the mental health gap between Asians and white.
Yeah, okay, thank you. And then another question for you. What are the factors that explain the rise in anti-Asian racism? What are the factors that explain the rise in this issue during the pandemic in particular? There's
several reasons, right? So first is, like I mentioned, is because the outbreak was started in China. In Asian countries. The second is that media coverage, right? A lot of coverage of Trump's Chinese virus and those kind of media coverage could also lead to higher stress and anxiety among Asians. And then also the historically, so probably that's the most important reason. Historically, Chinese or Asians in general were discriminated in the United States, also in Canada. They were seen as perpetual foreigners. So that historical reason is probably the most important reason. I think one question was that it's not just happening now, it's a historical over time issues. The pandemic, it just make it even worse or expose this issue at higher level.
Yes. Yeah. There's another question sort of jumping off from the previous question that you answered for us. Wondering if you could help us understand what in your research, the comparison specifically to white populations and not a broader population. So comparison to Asian to white versus Asian to sort of a multicultural population.
So there's the very good question. That's just data, several reasons for the survey data. So in Canada, we collect back in April, in May, we collect national representative survey data. And in that data, we only have 2,000 respondents. And the minority population, the sample size is very low. So we couldn't include other, in general. So we exclude those other minority groups in the data analysis. And for the US study, because one reason, the big reason is that before the pandemic, the Asian Americans, Asian immigrants, they report, for example, fewer instances of discrimination or harassment. And then they also have better kind of mental health, right? Not all groups, for example, not all groups. So that would be a good background. Setting up my research is that how the pandemic changed the gap, right? If we include a lot of First Nation people and also other minority groups, so then you won't be able to see the gap like before pandemic, it's clear that Asians have higher, or after the pandemic, how that gap is changed.
Yeah, yeah, understood, understood. We have time for one more question, I think. So this is starts with a comment and then a question. Thank you, Cary, for this amazing presentation. Do you find that discrimination towards Asians match, oh, the question just popped away, just a moment here. Do you find that discrimination towards Asians match levels from when SARS first came around in 2002, 2004? Or do you think that the media presence that we sort of just talked about and the rise in the not accurate news has increased discrimination? So just your opinion on that.
Yeah, very good question. I don't have data and then like about like how Asians were discriminated the level during the SARS pandemic,
okay.
right? Because
Yeah.
I don't have data. But then I would agree with that the media could play a big role in like especially today, because like Twitter or all those media, people spend more time on media, and the media coverage could lead to higher impact on the mental disorders among Asian Americans and Asian immigrants. Well,
Yes, yeah. Thank you for that. So I guess on the slide, in terms of what can be done, for sure, making the mental health support more accessible, and as the medical field sort of tackling it from the medical field. But then there's also, this goes with so many things. There's a responsibility that our media and politicians have to be accurate and objective and not sensational, because the damage, the impact of that is massive. It's just massive on people's health.
Yeah.
But all of this are sort of big orders, big pieces of work, but very, very necessary. So thank you so much. It's all the time we have for questions right now. We're really, really appreciative of you taking the time to be with us today, Cary Wu. That was really quite excellent. Before we do say goodbye to our audience, though, we do have one last question, poll question for you. And the question is, now that you've heard Cary speak, how would you rate your understanding of the topic after hearing Cary speak and hearing him answer your questions? If you could take a moment to share that, and that's always helpful feedback for us to have. Thank you so much for joining us today. Feel free to share today's talk with your friends. It will be posted on our York Alumni YouTube channel. You may also join our LinkedIn group or follow us on Facebook by searching York University Alumni, and follow us on Instagram and Twitter at YorkU Alumni. Feedback about this or any of our programming is most welcome and can be sent to us on our social channels or by email at alumni@yorku.ca. Scholars Hub at Home is back next week for our topic is youth dating during the pandemic. That's on Wednesday, October 28th at noon Eastern Time with Dr. Sarah Flicker, Professor Environmental Arts, Faculty of Environment and Urban Change, and York Research Chair in the Community-Based Participatory Research. To learn more about that and to see our fall lineup, please visit our website at yorku.ca/alumni and friends and click on events. Thank you again to Professor Cary Wu and to you and our audience for joining us today. Please keep well.